nobody who knows it all. So I want to implore everybody to just bring to bear their knowledge, their own personal experiences of people that they know, and feel free to type in the chat as the presentation is going on if you have questions, but I may not be able to see or monitor the chat until the presentation is done. So Ivy, if you don't mind, you can just help me monitor, and if there's anything I need to like stop and attend to, then I will do that. Otherwise, I will be answering the questions after the whole presentation, just so I'm not I'm not going off track of what I'm doing. So this afternoon, I've titled this whole thing Vagina Basics because initially it was vaginal health, but when I started preparing for the presentation, I realized that if I want to do vaginal health, we won't live here. Like it can't be covered in one presentation. So I thought it wise to focus this initial forum session to our basics. Let's go back to the basics. What are the things we're doing wrong and what can we do right? And if there is a need, or if there's popular demand, or if there's anything pending, then maybe we can reconvene another time to do the more in-depth things about women's health and vaginal health generally. So this is just more like a disclaimer to say I'm not going really deep. I don't want you to be disappointed that, oh, you expected to hear about STDs and I'm not saying anything about STDs, because there's a plethora of STDs, and where am I going to start from in 1 hour? So that said, our presentation is Vagina Basics, and I'm saying let's talk because I want this to be like an interactive session, like a town hall meeting where everybody brings his knowledge, just like I said before. So thank you again for coming. Like Ivy said, my name is Irene. I'm a pharmacist and I practice in substance abuse right now. But women's health is my passion. It's something I do for fun and I enjoy it. And so I find myself volunteering a lot around the community to help women generally, and I started doing that even in Nigeria before I came here. So just before we start, I have this little funny video for you guys. So let's just spend a minute. It's just a very short one. I'm not sure if it's going to play, but I can try. Okay, it's not playing. I thought so.
Welcome to
okay.
Vagina. Do you have a reservation with us? Yeah, kind of.
Is it loud enough though?
I'm here every month.
Yeah, I can hear it.
Sorry. What, you're early? Surprise. Wonderful. And we've just got you for the 5 nights, right? Yep. I don't pack light. Great. We'll just get someone to take the bags to the room for you now. I hate to do this, but I am a big fan. Right. Can you be careful with all of this? Yes, of course. Okay. We've got you booked for a suite with free balls to all body parts. Have a great stay. Oh, I will. Look, I am so sorry to disturb you. We've given you an additional night with no questions asked, but we are going to have to ask you to leave now. You have outstayed your welcome. You know what? I think I'm actually going to extend my stay. No, see, we can't actually do that. We are fully booked at the moment, and we do have a guest waiting to check into this room. It's like having a bloody spotter. So can I check in now?
Okay, so that was just on a lighter note about the kind of things we go through as women. It says my internet is unstable. If I'm freezing, Ivy, please just let me know. I got a notification on my screen saying my internet is unstable. So I may not know when you guys stop hearing me. So please just alert me so I'll know.
I'll let you know. Okay.
Okay, thank you. All right, so that was just on a lighter note. That video was just saying about how our hormones and our periods and everything can just, just make a mess of us, and we're still going. We still see it every month. and we still keep going and we're strong. So that was just there. So to start, I'm going to share a few questions here to test our knowledge. Let's know what we know. What we don't know. So feel free to type your answers in the chat. I will just give maybe 10 seconds when I post the question, and then I will post the answer after. So if you know the answer or if you want to participate, please just put your answer in the chat. I can't, I know people would respond. So the first question here is, the vagina includes the labia, the clitoris, and the mons. True or false? The vagina includes the labia, the clitoris, and the mons. True or false? So just 10 seconds and then I'll move on. Okay. Thank you guys for answering. I see a few answers there. So the answer is false. I will not be elaborating here right now, but as we go through the presentation, you will find the answers to your questions, or if you're doubting the answer, you would find the reason the answer is false. Moving on, second question. All vaginas are the same shape and size. True or false? All vaginas are the same shape and size. True or false? 10 seconds and we'll move. Thank you. I see answers. Thank you. Okay, thank you. I just see my chats going up in numbers, so I know people are putting in their answers. So answer to this one is false. Next question. The G-spot is a specific area on the vaginal wall. The G-spot is a specific area on the vaginal wall. True or false? Oh, I put the answer too fast. Okay, so that's false. That's false. That's a bonus for everybody. Next question. Kegel exercises can help with incontinence, easier vaginal delivery, reaching orgasm, all of the above. Kegel exercises can help with incontinence, easier vaginal delivery, reaching orgasm, all of the above. Thank you, guys. Like we'll just call it a day here because everyone knows the answers, right? So yes, this one answer is D, all of the above. So 2 more questions and we'll move on. Next question. After childbirth, the vagina may A, feel looser, B, be more dry, C, change color, D, all of the above. After childbirth, the vagina may A, feel looser, B, be more dry, C, change color, D, all of the above. 10 seconds and we move on. Great, 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 great. Looks like we'll just go home today. Okay, so answer is D. So all of the above. Last question. Uh-oh, I repeat this one. Looks like I repeat this question, so we'll move on to the next slide. Thank you, guys. Thank you for answering. So the main presentation is going to start now. So I have some information for us here. First thing for us to know is the vagina is an internal organ. You cannot see it. So a lot of times you have people talking about, oh, my vagina is itching me, or my vagina has a boil or has a lesion or something. It's a wrong use of word. The vagina itself, it's an internal organ, and it's like your kidneys, your liver, the things you cannot see. That's the vagina. What you have outside is your vulva, and that includes your labia, your clitoris, every other thing outside is your vulva. So it's my vulva is itching me, or if your vagina is really itching you, then yes. So we know the difference. And then that said, the vagina is self-cleansing. I know we've heard this a lot of times, and it's very controversial and debatable, but it is what it is. The vagina is self-cleansing. Just like you don't need to wash your kidneys and you don't need to wash your liver, that's how you don't need to wash the vagina. Going forward, I would explain why and how it is like that if anybody wants to know, but it is self-cleansing. the vulva now needs to be washed with appropriate pH balance soap. Our vagina is moderately acidic. Yeah, it has an acidic pH. So when you want to get the unscented soaps that you want to use to wash your vulva, try to get the soaps that are within the pH of the vagina, just to prevent it from, disrupting the pH balance there. You want it to stay acidic. The vagina expels foreign content on its own. So if you push something into your vagina that is not supposed to be there, the vagina on its own is going to be trying to push it out by itself. Good bacteria live in our vagina, and we need them for pH balance. We have good bacteria everywhere in our bodies, most places. And it is the balance that we have. Whenever we get sick, it means that bad bacteria have overtaken the place and the good bacteria are struggling. And so that destabilizes that balance, and then we get sick. So they are there in the vagina and we need them. You don't need to wash them out. And then vaginal walls can be made firmer and have better grip with Kegel exercises and with surgery. This I would explain as we go on. So next, talking about the vagina, what's normal now? Like we have a vagina, everybody knows, but what's normal? Your vagina is not supposed to be dry. There has to be a discharge coming from your vagina at different times of your cycle. The discharge changes, but there has to be a discharge because it's supposed to stay moist and lubricated. If you have dry vagina, then there's something wrong that needs to be checked. So the discharge for the most part of the cycle is supposed to be white and milky. Towards the ovulation, it turns into a slimy and thin discharge, but for the most part, it's white and milky discharge. That's what you want to see. The smell and the taste in quotes, it should be tangy or musky. So musky smell is just like flesh. It's like raw smell, kind of like if you have an idea of what raw meat that is not spoiled smells like, something like that. So the vagina is not supposed to be odorless. And then there should be no pain whatsoever, no pain at all, whether with penetration or without penetration, there should be no pain. So one of our talking points from the flyer was that we want to demystify some of the myths. In my practice, both in Nigeria and here, it's interesting to know how a lot of things are misconstrued, and it causes so much friction in people's relationships. And unfortunately, you don't follow them home as the provider, so you can't even say how much trouble that has caused, but it's misinformation, but you don't have a chance to correct it and stuff. For instance, there was one day I was at work, and a couple of the wife had done a blood work, a test, and they came, both of them, to retrieve it. And she retrieved it, and the test was positive for E. coli. And the husband just, started saying she cheated. Where did she get it from? It's coming from a place of ignorance. And so right there, he blew up, and it was a drama and stuff. And then a man will come test positive for chlamydia and say, my wife must have gone somewhere. She must have gone somewhere. Otherwise, where did I get this from? So some of these things are just not fully understood by people. They feel once there's a problem down there, their spouse, partner, whoever it is, gave it to them. And that's all they know. That's all they don't feel they can do something wrong on their own to get it. They don't think that their own bacteria in their body can get imbalanced and get it, just the way you can get a rash. They don't think that. They just feel somebody gave it to them. So this myths things that we need to talk about, so we can just know what can be given to me and what is not necessarily given to me. I'm carrying my thing on my own, and I don't have to accuse anybody. So first myth here, everything here in this slide is wrong, okay? So these are myths, not facts. First myth, it is necessary to use specialized cleaning products. I'm sure we all know that's not true. You don't need anything special down there. No scented tissue paper, no scented wipes, no nothing. Just The place just wants to be left alone. Take antibiotics or antifungal after every period or cycle. I cannot count how many times I've heard this one from people, and people actually do it. It's not true. You don't need it. For every antibiotic you take, just as the name implies, it's against bacteria. So it's going in there to fight whatever bacteria you may have. And if it doesn't find the bad bacteria to fight, it's going to fight the good ones. And so you're probably making things even worse by doing that. Your period is not a sickness. It doesn't need to be treated. So you don't need it. If you find you're itching or your vaginal area is not having a good, it's not smelling the way it should after your period, there's an underlying reason, and that underlying reason should be investigated and treated, but not as a routine. After every period, you just want to take antifungal and antibiotic. Next myth, some women just experience pain after sex. It is normal and it's due to the penis size. That's not correct. Like I said earlier, there should be no pain, regardless of the size of the penis. There should be no pain. If you're experiencing pain, you want to take a step back and check what is going on here. Why is it hurting me when I'm having sexual intercourse? I mean, that's different if there was some rough activity going on or something. It's different. But if everything goes the way it should go, you're not supposed to experience pain. I read somewhere it says the vagina is a forgiving organ, more like whatever you put into it, once it comes out, it tries to fix itself back, expels the dirty things, tries to contract, and all of that on its own, doesn't need your help. So if there's any pain coming from that place, you want to check. A tampon can get lost in the body. That's not true, simply because the cervix has a very tiny opening, and except there is contractions going on, like during labor or something, that opening doesn't open. So for a tampon to be able to pass through the opening of the cervix and get lost in the body, that's almost an impossible occurrence. So that's not true. Every woman who does not experience orgasm during sex has an unhealthy vagina. Again, it's not true. Orgasm, it's individualized. What may make person A have an orgasm may not make person B, and both of them have absolutely healthy vaginas. So that is not true. A wide or loose vagina is due to too much sex or use of the vagina. Again, not true. I'm back to something I said before. The vagina is highly, I don't know how to describe it, elastic. If you take your time to study the anatomy of the vagina itself, the walls have kind of some rough ridges that are called fimbriae. They, on their own, it's just like a band, like when you have a rubber band and you pull on it. If you release it, it doesn't stay where you left it. It goes back on its own. Now, with continuous pull and everything, yes, it may not snap back right away. Neither may it snap back. Would it snap back like back to its original? But it would definitely snap back. So that's the vagina. Too much sex or too much use of the vagina cannot make the vagina wide if there are no other things that I would mention later in the presentation that would make the vagina wide. All STIs will show symptoms. Of course, that's not true. We know that almost everything has like an asymptomatic phase where the person carrying it doesn't show anything. Everything is all okay, and when they go to test, they find an organism there. That happens a lot. Even when it's not the asymptomatic phase, people can carry transmissible diseases for years and years, and nothing shows. We have our T cells, our immune systems that fight, and except they get overpowered, nothing shows on the outside. So it's not all STIs that show symptoms. Vaginal discharge is always unhealthy. I'm sure we talked about that in the last slide, that the vagina is not supposed to be dry. So that's not true. Semen does not affect vaginal flora. That is not true. It does affect vaginal flora. So after every sexual intercourse, make sure to clean, make sure to wash, because semen is basic. And like I said earlier, vagina is acidic. So if you allow semen stay and you don't clean it, and the vagina expels the ones that it can expel, and somehow some remain there, it's going to destabilize the flora of the vagina and cause issues. So semen does affect the vaginal flora. So moving on. I hope I'm not too fast. I'm sorry if I am. I'm just trying to get through this as fast as we can. It's Sunday and everybody needs to go get ready for next week, for this week. So we're talking about three main basic vaginal conditions that I see on a day-to-day. Like those are the most common that we see. Let's deal with these ones, know how to differentiate them, know what to do when we have them, and then we can decide to do more advanced and more complicated ones maybe later in the future. So the first one here is candidiasis. Three very simple things about it. There's no order on this one. It itches a lot. And the discharge that comes from this one is like cottage cheese, or it's curd-like, if you want to call it. This is the simplest way to identify candidiasis. If there's no itch, then it's not candidiasis. If there is an odor, then it's not candidiasis. And if your discharge looks like something else, then it's not candidiasis. What is candidiasis now? So I just put this bowl here just to show you what cottage cheese looks like. I didn't know it myself. I had to go look what's cottage cheese. Then I saw this is what it looks like. So if your discharge looks lumpy and white like that and all of that, then possibly your culprit is candidiasis. It's commonly called yeast infection or toilet infection in Nigeria. I've heard that name a lot. It's caused by a fungi. So what does that mean? Antibiotics would not work. So if what you have is candidiasis and all you're doing is taking a ton of antibiotics that somebody brought from Nigeria or wherever you got it from, you're making matters worse. It's not going to go away. It may faint. So the fungi may faint because you're doing something to kill them, but they'll wake up. It will come back because you're not treating the right thing. Like I said, cheese or curd-like discharge like this. There's no odor to this one. It's itchy and it's not sexually transmissible. You can have sex even while treating candidiasis. So this one, you can't transmit it. The person you're having intercourse with cannot pick it from you. If they have it, they got it on their own. So there's no need to stop having sexual intercourse while on this one. No need to treat partners, but you want to consider treating partners when there is recurrent infections. So the reason for this, I know it's kind of looking like it's contradicting this, but no. This last point here is basically because that person that you are having sexual intercourse with may have the candidiasis and may be reinfecting you, may be giving it back to you. So if just only you treat and then it doesn't go away, it comes back, then probably it's your partner who is the culprit that needs to be treated. And that way, then it's not going to come back. So that's the reason that if there's recurrent infection, it goes, it comes back, goes, it comes back, especially if the right treatment is used, then you want to consider treating the partner. That's that for candidiasis. The next very common one is trichomoniasis. Trichomoniasis, two cardinal things about it. It's foul smelly, but there is no itch. I think it itches. Sorry, I will correct this slide. It itches, but it's not as bad. So if you want to put candidiasis itching on maybe 9, you want to put trichomoniasis itching on maybe like 4. It would just be biting, like, not itch, actively itching, but it has this, it may itch. So I would correct this. Sorry about that. And so key things about it. Its own discharge is off-white to yellow or greenish. So now we know one difference. Candidiasis is white and it's curd-like, it's cuddled. This one is not cuddled, it's off-white to yellow or green. that kind of color, then this is your culprit. It's foul smelling, very, very foul smelling for trichomoniasis, very foul smelling. It's caused by bacteria. So what does that mean? It needs antibiotics. So if you have trichomoniasis and you grab a canesten from the aisle, you're just wasting your money and your time. It's not going to go anywhere. It may itch. So just like I corrected on the last slide, it may itch. It's not as bad as candidiasis, but it could itch. This one is highly, highly sexually transmissible. So when people say, oh my God, the man smells, it's probably trichomoniasis, not a hygiene matter. So it's probably trichomoniasis that has been picked and needs to be treated and is not treated, because a lot of times most men don't think they should treat these things. So when there is an odor and it's not hygiene and you've done everything to clean and there's no improvement, then maybe we want to look. They wouldn't have the discharge, of course, but that odor should be a sign that, okay, maybe we should just treat for trichomoniasis. So it's sexually transmissible. You have to treat all current partners. So all, meaning, okay, if you have more than one sexual partner, then you have to go around everybody and treat them. Otherwise, if you treat only one, the other one's going to give it back to you. So, and then no sexual contact until treatment is complete. Sorry, I went back too quickly. So no sexual contact until treatment is complete with this one. So of course, that I just explained why, because you want to finish up treatment, be sure that you're free from it before you continue having sexual intercourse. If not, you're going to pick the infection again. I'll talk briefly about what is used to treat them maybe later. I'll just mention it, but that's not the focus here. It's just for us to be able to differentiate these things and know where to go seek for help. So if you have trichomoniasis and you're on the aisle, you're probably in the wrong place, because you won't find anything over the counter to treat trichomoniasis. No, you have to go get a prescription for it. So just know where to channel your energy and all of that. So moving on, this is the fishy one. I have this shark here to remind us that this is a fishy, the popular fishy smell. Everybody, guys, when they want to throw jabs at ladies, she's smelling fish. This is the one. So it's called bacteria vaginosis, BV in short. That's the common name that you hear around. It's called BV, and that's the one that smells like fish. So that's a big differential diagnosis for this one. Once it's fish, it's BV. No need to keep looking. So cardinal signs for this one: gray or milky thin discharge. I know I did say at the beginning that our normal discharge should be thin and slimy during close to ovulation, and the rest of it should be milky discharge. But this one, because you're going to have the fishy smell with it, then you kind of know that, okay, something is wrong somewhere. With the normal ones, you won't have any odor. So, and then it's gray a lot of times. In fact, most of the time, it doesn't stay milky. It turns gray. There's no itch with this one for sure. And it needs antibiotics because it's a bacteria and it's not sexually transmissible. So that's why you hardly find men smelling fish. It's always women smelling fish. It's not sexually transmissible. So a man cannot pick it. And that means that even while treating, one can continue to have sexual intercourse, but it pushes the bacteria up into the urinary, up into from the urethra to the bladder and all of that. And we don't want that. So it's always best when there is something wrong down there, just stay away for a while, even though the books say you can go ahead and have sexual intercourse, but for your own good, because if you push it higher up, it becomes a more complicated thing to treat. And that's story for another day. It becomes an upper infection and not a lower one again. So it's not sexually transmissible, but again, wisdom for us to do what we have to do. So yeah, those are the three major and most common conditions that we find disturbing us down there from time to time and on a day-to-day basis. So moving on, what are the consequences if I leave these things untreated? Number one is the smelly ones, you're not going to stop smelling. Even if you wash, you go to the bathroom, you have your shower, you come out, just a matter of an hour or two, the smell comes back, right? So nobody wants to be smelly. Infertility is one big one, and I just explained the reason. The bacteria, when they are left untreated, they become very comfortable there. Then they start moving and they travel along your reproductive tract, and they go block the tubes and cause issues, very complicated ones. They first start from like pelvic inflammatory disease. You know, they cause inflammation in your pelvis, then they move up from the pelvis and go into the tubes and like that. So complications with pregnancy, that one is a big one. Premature birth, a child born with like eye infections and stuff like that. Those are some of the complications that can happen with this one. It can even cause miscarriages if left untreated. Poor and unpleasant sexual experiences. Sexual intercourse would hurt. Of course, the odor would not be a pleasant one. There would be dryness. You know, your vagina is going to be sore. Little activity here and there, you would not, you know, want to engage because you just feel very uncomfortable down there. So those are some of the complications that we have. Okay, so now that I know, then what? Right? You know the differences now. You know that, okay, so that fish I was taking canistin for, I was just wasting my time. And, you know, that green discharge I saw, I was supposed to go get a prescription and stuff. So then what? That's where you want to prevent before it happens, right? You don't want to wait. Nobody likes to be running around and looking for and inserting things in their vagina or taking pills that everyone is asking, what are you taking pills for and stuff. So self-care, self-care, self-care. We hear this a lot, but what can you do? You want to prevent before it happens. Like I said, wash, wash, wash. No soap in your vagina. That's common knowledge. When you put soap in your vagina, you are destabilizing the pH of the vagina, even if it's a pH balanced soap, because there's so many things that are used to make soap. That foam that you see is soap foaming. It's a surfactant, it's whatever it is, they come together and make the soap. So it may be pH balanced, but how about the other things that were used to make the soap? So you don't want to put soap in your vagina. At the most, if you have to dip a finger in your vagina to say you're washing it, just put your shower head and spray water and leave it like that. There's no point. It's not a dress that you need to scrub vigorously. It's not dirty. It takes care of itself by itself. You don't wash your kidneys, so don't wash your vagina. Now you want to wash your vulva, okay? That one you have to wash. If you do not wash it, you're going to smell. That's the one you want to get the pH balanced soaps to wash. I don't want to advertise it for anybody here, but I have used pH balanced soaps in my vulva for the longest of time. I don't smell. I don't have itching. Nothing happens. So the argument that you see on social media and everybody saying, don't even put soap at all there, it's not true. If your soap is to wash your vulva and it is a pH balanced soap and it is unscented pH balanced soap, you shouldn't have a problem there. And if you're having a problem, then we want to check that soap and we want to check other things you could be doing. Like maybe you're having baths, right? Maybe you're soaking yourself in the jacuzzi or the bathtub, and the shower gel, you know, that you put in the water, somehow because you're sitting and you're soaked in there, it's getting in, because the vagina is a hole, it's open. So somehow it's getting in there and causing the problems. So you want to look around and see what other thing you could be doing that is still causing all the problems, despite that it seems like I'm doing the right thing. Change tampons frequently. That's for people who use tampons. Tampons are very big culprits for infections. They are good to use when they are used properly, but if they're not used properly, you don't change them regularly, or when you're dipping them in, you had dropped them on the, you know, bathroom counter, and maybe they picked up some things from there, and then you pick them up and then put them back in. You probably put something together with it in there. Then douching is another controversial thing, but bottom line, don't douche. You don't need to flush anything out of your vagina. If you didn't put anything there, why are you flushing it? So if you over flush and flush your vagina out, you're washing your good bacteria out, and then bad bacteria, they have a party there. So you don't want to douche. Pee and clean up right after intercourse. Like I said earlier, semen is basic. Vagina is acidic, so they're opposite. So if you bring in a basic thing, basic and acidic, I'm sorry, I'm using, they are the terms that describe the pH, okay? So the higher the pH, the more basic it is, the lower the pH, the more acidic it is. So the vagina pH is around the acidic range and the semen pH is up there. So when you bring the semen in and you don't get it out, then it goes there to cause issues, changes the pH of the vagina. Then because bacteria and fungi, right, they can't survive in acidic pH, they die. So if they survive in your vagina, then it probably means that the pH was distorted, and that's why it became conducive for them to live there and stay there and grow and multiply, right? So if there was no pH balance, a fungi cannot survive in the vagina. Sorry, pH imbalance. A fungi couldn't have been able to survive. Other things you can do, mind the use of antibiotics, We jump at antibiotics for the slightest reasons. Oh, I'm coughing, antibiotic. Oh, I have a headache. I think it's typhoid, antibiotic. Oh, this, antibiotic. All those antibiotics we take, they are systemic. So it means they work the whole body. They are not just going to kill your typhoid or kill your whatever it is you thought you had. They are going to work all over the body. So including your vagina. So when you take something systemic through your mouth, picture that it's going everywhere to go and kill whatever it needs to kill. And especially the broad spectrum ones, let me add that here. So if you keep taking antibiotics for other things, you could be destabilizing your vaginal flora in the process. Probiotics, natural and synthesized. There is a small debate around this, but there is evidence to show that probiotics do have a role to play in helping us balance our flora generally, not just the vaginal one. So if you take a probiotic through your mouth, what are probiotics? First off, they're just live bacteria that are in capsule form or tablet or gels or whatever it is. Basically, they exist. I tell people, don't jump on a drug if you don't have an absolute need for it, because for every pill you take through your mouth, your liver does a job and your kidney does a job on it. Why overworking them when they don't need to work? Because when you're older, you're going to need them. So why do you want to just give them so much work to do when it's not like it's necessary? If you come to me and say, oh, I want to be taking supplements, I'll ask you why. That's the first thing I'll ask you, like, you don't eat, or, you know, do you feel tired all the time, or blah, blah, blah. No. Then why? Oh, no, my friend said. If you really do not absolutely need a medication, no matter how simple the medication seems to be, it goes through something in your body, and those organs have to metabolize and excrete it. And so you gave them a job. So for probiotics, if you don't have pH imbalance issues, I don't see why somebody would just wake up and say, oh, I just want to start taking probiotics. Because what they're supposed to do is just add to the strength of your own natural bacteria, your good bacteria. They're supposed to like energize them. Okay, if we were 10 before, now we're 20, let's fight, kind of thing. So when the bad bacteria want to come in, there's already too many of these ones and they can't really, you know, overpower them. I'm just trying to say it in the best way that I can for ease of understanding. So the probiotics, we have bacteria, these ones already live in our body. We just add to the existing supply and they fight. There's the synthetic ones, like I said, the ones that are synthesized into drugs. They are on the aisle. You can pick those ones, and then there are natural ones you can get from like cheese and yogurt and stuff like that. So if you wanted to balance your bacteria, maybe you want to increase taking yogurt. Breathable cotton underwear. I know we know these ones, no nylons. And honestly, to be honest, I know that there is a controversy around tongs or no tongs. Once in a while, wearing tongs is okay because that gives your vagina some space. It's such an occluded area, right? We wear underwear, we wear maybe some tights, we now wear our pants, you know, and all of that. So it's warm, it needs to breathe. And so that warmth that we create in the area just makes it kind of more conducive for these organisms to grow. So at every chance that you have to allow that area breathe, just try and take advantage of that. Make sure you dry the area when you shower. Make sure you take your time and dab it properly. You don't wear your underwear and trap moisture there. Wipe from front to back. This is supposed to be like normal, but you'll be shocked. There's a lot of people who just put their hands underneath and pull it forward, right? And it seems convenient to do than turning your hand to the back and wiping. But if you did that, you're just taking so much from the back and putting it in your vagina. And that's a big problem. People do that a lot, wiping from back to front. But please, 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 even after peeing, wipe from front to back. Wash hands before touching your vagina. This one I know we may not do because how can I be washing my hands every time? But if you remember and something has to take your hand to your vagina for whatever reason, whether to shave or to do whatever, to wax, make sure that you wash your hands properly. There is a debate on apple cider vinegar, boric acid, and garlic. There is no evidence to show that these agents help with keeping the vagina healthy, and they're not Health Canada approved, unfortunately. So you're not going to find boric acid used for yeast in Canada. Maybe other places, yes, because there is there is a scientific evidence that because it's an acid, when you take it, it kind of makes the vagina become acidic again. So balances the pH and, makes it healthy. But for this presentation, I'm not going to advocate for it just because the climb where I practice, it's not advocated for because there isn't enough evidence to show. Garlic, it's a blood thinner. So even if garlic has an advantage in vaginal health, we want to shy away from it because it can be doing more harm than good, right? So if you take garlic a lot, you're thinning your blood, then you can have bleeding issues and then no oxygen and then shock and then, so we don't want that one. Cranberry is not a known agent for UTIs and vaginal health. It can, because it's acidic, it can maybe do something, but there's no evidence for cranberry. So a lot of people take cranberry juice. If you already have UTI, it's not going to cure it. But maybe if you take cranberry juice regularly, just maybe it could help to be maybe preventative in addition to other things you're doing. Like we said, cotton underwear and loose fitting clothing, not tight clothing all the time. I'm going to speed up because it looks like. So I've actually gotten to the end. I only have a few slides left. This slide is just telling us that there's many other things that we can talk about here. These ones are all sexually transmitted. We have anogenital warts. We have genital herpes, gonorrhea, chlamydia, syphilis. These ones are all sexually transmitted. So if anyone tests positive for these things, they want to look around their sexual partners and also get them treated as well. Like I said, we can talk about these ones if we're curious about them or want to know more in another session, but this session is beyond the scope of this session.
So,
okay.
All right.
Yeah.
Okay. I wanted to say that there are questions in the chat box, and so I wanted to know when you would like to have them. Take them.
Okay, yeah. So I would answer the questions now. I just have some questions that were sent in advance during registration for the session, and I made slides for them just so I don't forget. So I would attend to those ones since I already have their answers here, and then I'll go back. Maybe some are even repeating themselves. So let me start with my first question here. what causes waist and lower abdominal pain during ovulation? So basically, the simple answer is follicular rupture. That's just a big name. What does that mean? So what is ovulation? Ovulation is your ovary has released an egg. That egg is usually immature. It grows inside a follicle. Okay, so let's call it a capsule, kind of. So it grows and matures inside that capsule, and then it travels from the ovary into the fallopian tubes and all of that. So now, when it gets to your ovulation time, that ovary has to release itself from inside that follicle. So now, when it's trying to squeeze itself out, like it's going to rupture the follicle and come out. That is what mostly causes the pain that we feel either at our back or waist or lower abdomen or wherever it is. That's mostly what causes that pain. There's also a little part that progesterone as a hormone plays. So progesterone increases so much when we ovulate, more like after ovulation. So, and because it has a relaxing effect, so you can imagine when you're doing a massage, right? At the time of the massage, it kind of hurts, but afterwards it now feels good because, you know, the muscles are now all relaxed. So progesterone also has that kind of implication, not very much as the follicle thing, but the progesterone increase kind of it's like a massage. It relaxes us and then causes some aches. And then when it starts going down, we are free from the aches. So that's the answer to this one. Normal little analgesics like Tylenol or, you know, at the most Advil, if you don't have other underlying health conditions that make you not a candidate for Advil, should be okay. But if it's so bad, then you have to get checked. Question 2 is, how do I manage persistent yeast infections? So like I said, make sure you're doing everything else right that we have discussed. Just make sure you have all your boxes checked. If it's still persistent, then you're probably having some issues around your immune system that they need some help and all of that. And there is Health Canada approved prophylaxis for people who have recurrent candidiasis. You would have to take the medication is called fluconazole. The doctor is going to place you on like 150 milligram of it every week for I think 6 months. If you have recurrent candidiasis and they have found you're doing everything else right, it's not based on something wrong you're doing, your partner has also been treated and it's still coming back, then you can become a candidate for that long-term treatment. And it's expected that after that course of antibiotics once weekly for 6 months, and sorry, it's not antibiotic, antifungal, sorry, for 6 months, that you don't have that candidiasis again. If it's still coming, then they have to, you know, do a swab and check what is there. Is it really candida or something else? Okay. Question 3, ways to tighten the vagina. Are there ways to tighten the vagina? In all honesty, basic medicine is only Kegel exercises. And people say it doesn't work, but they're not doing it right. If you Kegel, you want to hold for about 10 seconds before you release, right? So if you contract and you just release it right away, it's not really, you're not going to see the long-term benefit. And if you hold it for 10 seconds, you have to do that many times a day, right? So you can't just Kegel 5 times and say, oh, done for today, tomorrow again. If you want to strengthen or contract a muscle, just like workout in the gym, right? You have to be consistent with it and do it over and over again. Let it become a habit, a norm, that you're just sitting down, boom, you hold, you release, boom, you hold, you release. And then gradually you would see the effect come out. There is surgery for sure. There is surgery, it's vaginoplasty, that can tighten the vagina back. That's a reconstructive surgery that you can talk to a surgeon about. There is a non-invasive method of surgery. It's not, okay, I won't call it surgery because once the surgery is kind of invasive, but there's a non-invasive method of using like radio frequency and laser. They kind of put it in there, and then the heat that it produces kind of contracts the muscle in there, and then it holds it in place. So there are options. If the vagina feels loose, and you are actually sure that it's loose, then you want to, like, get a consult and see if you're a candidate for vaginoplasty, if you're open to it, or the non-invasive one. But try your Kegels, do them right, do them very often, and, see if that's going to help. Question 4, does childbirth expand or losing the vagina? Okay, this one I put yes and no here, because there is a bit of an explanation to this one. So if you picture this band in my hand now, and I expand it this way, and I loosen it right away, it comes back. If I expand it today, expand it tomorrow, expand it, and keep expanding it, at some point, it will snap back, but it won't be that, this already shows you, it won't be that tiny anymore, right? It will definitely snap. It's not going to stay like that. It's not going to stay like this. It's not even going to stay like this. It will snap back totally, but it's not going to be the exact same size that it was before I started pulling it. So what does that explain? That explains that there are people, okay, who, just like we have different sizes of penis, we have fat and short, long and thin, bent, curved, everything like that. That's how the vagina is. Some people's vagina on the inside is not straight, it's curved, it's bent. Some people's, cervix is way higher than where some people's own is. Some people have, thinner vagina orifices than some. So childbirth is not an absolute factor for a loose vagina. Now, if the person asking this question had a very sure that, oh, before I started having children, my vagina was tight, and now I only have a child, or I have 2 children, it will be different than someone who has 7 children, okay? It will be different from someone who has had kids. Sorry?
Okay, fine.
Somebody was unmuted. Please, Tonya, kindly mute you. There's a lot of background noise. Tonya.
Okay.
Okay.
Thank you.
So it's going to be different from someone who had their kids in quick succession, okay, and all of them vaginal births. So if I had a kid, 9 months, I get pregnant again, have another one, 9 months, I get pregnant again. I'm not giving the vagina enough time to snap back, and I'm expanding it again. And I'm not giving it enough time to snap back, and I'm expanding it again. So that way, you would not be able to get back your elasticity to original, okay? You can have children and have your vagina near what it was before you had a kid, like extremely close. The change may not even be noticeable. There are people who have never dropped a kid, but they still have the wide orifice. Genetics plays a role, okay? What genes were you born with? What plays out with your mother will most likely play out with you. Not in everybody, just the way I must not inherit my mother's nose. That's the way you may not inherit it, but genetics has a role to play there. But you can have kids and have an intact vagina. So that's why the answer is yes and no. It can expand it, but there are factors that would lead to that. And it may not expand it. There are factors that would keep it where it is. I had something here that I thought I would share regarding this. This was somebody who, by the way, I have the permission of my place I volunteer to share this. So someone came to us and he says, my girlfriend needs help. I'm just going to be honest. She's a beautiful person and very honest, and I like her. She's a decade younger than me, so 10 years younger. And she has had no kids and only one other boyfriend. She's very loose down there. I'm actually a big person, that is penis-wise, and I can tell you there's no grip. She has tried everything, creams, whatever. We went weeks without touching her, trying to see if we can allow everything go back. And I'm still disappointed because everything is still as it is. So that's just an example, okay, that giving birth to children is not a ticket to a wide vagina. No, you can have kids and still have your vagina intact. and someone may not have kids and still have a loose vagina. I hope this answers this one. I've kind of stayed too long here. Question 5, how do I maintain a normal vaginal flora? I think I've shared it during the presentation already, except there's something else that I would look at the chat questions, but I've shared it. Basically, doing your things right would keep your vaginal pH. Don't take antibiotics when you don't need them. Don't put things there. Try to allow space for your vagina to breathe when it needs to. Don't put anything, use soap to wash the outside, but not the inside. Pay attention to the soap you're using when you're soap bathing and stuff like that. Question 6, when should one be getting a pap smear? So based on current regulations in Ontario, pap smears are advocated for women over 21 years of age that are sexually active, and you should get it every 3 years. For those who don't know, the pap smear is the test that tries to find the human papilloma virus that causes cervical cancer. And so it's advocated you do it every 3 years. If your family doctor is not talking about it, poke them, remind them, ask them about it, that, hey, I've never done a pap smear before. And immediately you're done the pap smear and you get your result, even if it's your first time doing it, if your result is all clear, please, please, please go and get the vaccine. The vaccine is not covered, unfortunately, but if you can pay out of pocket, I tell you, it's better you spend $600 for 3 doses now than spend a lifetime battling cervical cancer. So if you don't have coverage from work or whatever it is, the government don't cover it, you have to pay for it, but it is worth it. I think a dose is around $200 to $30, and you need 3. So you will need the first dose, and then 2 months after that first dose, you will need a second dose, and then 6 months after the first dose, you will need a third dose, and that's it. You are immunized for life, but you have to keep doing your smears every 3 years because you don't want to be blind to what is happening, right? Even though we immunize against flu, people still come down with flu. Reduces the chances, but it's still a possibility. So you want to still keep doing your pap smears every 3 years, and that one is covered. The test itself is covered. If nobody is poking you, like writing you letters from public health to come and do it, or your family doctor is not bringing it up with you. If you don't have a family doctor, go to a walk-in clinic and tell the doctor, I want to get a pap smear done. They would, give you a requisition and send you to a place where you can get your pap smear. Question 7, why is there a boil on or around my vulva pre-menstruation? Okay, so this one, there are a few things that could cause it. Allergies is one. You could be reacting to something, but if it is close to your menstruation, then most likely not an allergy, because if it's an allergy, it won't just be coming like only pre-menstruation. It would just be there most of the time. So that one I would narrow down to contact dermatitis. Contact dermatitis is just like an allergy that is caused by contact with something. So maybe the tampons you're using, the pads you're using, maybe your skin is not liking it. Change it, try to see if that helps. Ingrown hairs, when you shave, sometimes the tiny hairs that are left there, when menstruation is coming, the hormones are all over the whole place. So it causes a lot of changes in our body, changes our basal temperature, changes things. So that could be the trigger for whatever was there to kind of manifest outside. So that could be a reason. And another possible reason is herpes simplex. Herpes simplex can lie dormant in a person for years, but with certain triggers, it can just make a lesion. So it may not be a boil. I think it's likely not a boil. It will be a lesion that has like a blister kind of lesion there that kind of hurts, especially when you pee and stuff like that. Then you want to go do lab work, blood work rather, to see if you will be herpes simplex positive. And if you are, it's not the end of the world. People have herpes everywhere, but at least you know, and then when the thing comes, you already know that, okay, it's herpes, and then your doctor would now have a ground for giving you something. There are creams that you can apply to those lesions and they dry up in a day or 2, and you don't have to nurse that pain until your period is over and all of that. So you want to check that one as well. Most times people with herpes simplex, they just tell you, go about your normal business, but when you're pregnant and you want to have a baby, just make sure you let them know that, oh, I have herpes, so that they know the things that they can do to protect your baby from all the eye issues and stuff that they can come out with due to that. So that's something that could be causing these ones. The hormones are all over the whole place. So the ailments or the conditions take advantage of that and kind of pop their heads out. Okay. So this brings me to the end of this presentation. I just hope, I know I've talked a lot and there's kind of so much content, but I just hope somebody has one thing at least to take home from this one. I will be happy. So I'm going in the chat now. I'm not sure where the question started from.
I can just read them out to you.
Okay.
Thanks so much for even the session. Very informative. There are a lot of things I have learned today. For someone who thought she even knew a lot, there's so much I have still learned. So thank you very much. So someone has asked, you said the vagina washes itself naturally as an internal organ. You also said that its fluid is acidic, and after sexual contact, one should wash off the semen, which is alkaline, to avoid issues. How can one wash off the semen from the vagina effectively, since it's an internal organ?
That's a very, 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 very intelligent question. But if
I'd also asked the question too, because I was like, okay, so how do you wash off? Is it like the regular wash, just water, the shower head, or none of that? So
yeah, so thank you for that question. It's actually very, very smart question, and anybody that listens properly would be asking themselves that question as well. But I also mentioned that the vagina is going to expel as much as it can, because remember I said it ejects things by itself, like on its own. I don't want you here, out you go. It's going to expel a lot of the semen out on its own. That's the one that is trapped in the vagina, right? Now, the ones that swim in, the vagina has no business with those ones. So when there is an ejaculation, not all the semen gets up there and swims and, you know, they die. You know, that's another subject. The sperm cells, they swim and everything. And then when there's no egg to fertilize and everything, they die off after 3 days and stuff like that. The ones that get trapped in the vagina expels those ones as much as it can. But to ensure that you don't have any leftovers there that could cause issues, flush with water, pee. Even just ordinary peeing would make, we pee from our urethra, we don't pee from our vagina. But when you pressure to pee, it puts the pressure on the vagina as well, and it helps the vagina to push out other things. So peeing alone can also even work, even without washing, putting the shower head and washing it with water. Just peeing can help. So peeing after sexual intercourse and rinsing the vagina with water can expel whatever semen you have left. The vagina will do the rest.
okay. Thank you. So another question, what is the implication of cessation of menstrual cycle due to the insertion of family planning for over 2 years? Is this healthy? What is your advice?
Okay, like I said, this session is so small and it cannot capture a lot of things. But if I'm to answer this, when you say insertion, I hope you mean an intrauterine device. If it's an intrauterine device that you're talking about, yes, their lifespan could be 5 years. So you don't need to change it or anything until 5 years. And yes, they would cease the menstrual cycle. And that's because they are hormonal. And the way they work is that the hormones that are supposed to go up, so progesterone is supposed to go up and estrogen will come down around our ovulation time. And then after ovulation, they kind of switch, and luteinizing hormone also plays a role. I'm sorry for my words. I don't know how else to explain it. But when you take those hormones through the intrauterine device or through your mouth, they make the one that is supposed to go up remain up. They make the one that's supposed to go switch, not go up and remain down. So because that change doesn't happen, the menstruation would cease, because it is that change that prepares the wall of our uterus that sheds to become menstruation. It is that change that makes it gather blood, you know, and then when there's now no fertilization, then the blood sheds, then we see it as menstruation. So because that change is not happening, the wall of the uterus doesn't gather the blood, and then there's no shed. So your question is, what's the implication? Absolutely none. Because once those hormones are pulled out from your system, your body's natural mechanism takes back, it just kicks back in. And so there's no increase in progesterone coming from outside. So your body will be forced to produce only its own progesterone. And there's no anything suppressing estrogen. So your body would use its own level of estrogen and they would do their thing. And menstruation will come back. It may take a while, for sure. I've had people say they stopped contraceptives for long and they couldn't get pregnant and stuff like that. And that's individual body differences. The way my body will recover after a surgery is not the same way someone else's would. It's the same thing with all these things. But recovery is for sure, it will come back and your body's mechanism will kick in. So there's really no, about fertility, there's no side effect, but contraceptives in general, especially the hormonal ones, they have long-term complications. They can cause uterine cancer in the future. They can cause deep vein thrombosis. There are so many things that they can cause, subject for another day, and that's why till date, oral hormonal contraceptives are not part of what pharmacists can prescribe, because there's a lot, like it's a big picture to decide which contraceptive somebody goes on. You have to look at other conditions the person has, other medications the person could be taking. Does the person forget? Things like that. And then when you look at the bigger picture, then you choose one. So it's not just a casual, consultation. Oh yeah, you want to go on contraceptives? Here you go. No, it doesn't work like that. So there's no fertility problem with ceasing your menstruation for 2 years. But because they are hormonal contraceptives, they have their own side effects, like every other medication. So,
okay, thank you. I think someone is asking, how safe is the constant use of panty liners? I guess it's in relation to what you said about, wearing breathable stuff for the vagina.
Yeah, so panty liners, well, if your discharges, that's the normal discharge, they are, soaking your panties, and you're not comfortable with it, for sure you can use panty liners. There's no bad thing about using panty liners, just the fact that you're occluding the area more, right? You are making it warmer, you're covering it, closing it, not allowing it breathe, making it a conducive place for, microorganisms to grow and stuff. So if you can, not wear panty liners twice a week and wear for 5 days a week, kind of give the vagina a break or give it some space to breathe. But there's no issues with using panty liners. No, it's just like saying, what are the issues with wearing my pants? Like, there's really no, you have to wear your pants, right? And it's still covering the place. So if you want to use panty liners because it makes you feel cleaner and everything, and it's not making you sick, then it's okay.
Mm-hmm. Okay, and then somebody else is asking, what's the name of the injection for the prevention of cervical cancer? I guess she's referring to the vaccine.
Okay, it's called Gardasil 9. So it's Gardasil 9, number 9. So it's called Gardasil 9. And guess what? Everybody from 9 years to 45 years old, it is advocated that they get their 3 shots of Gardasil 9. Okay, why? When I said HPV screening should be from 21 years, you don't get Gardasil 9 only for HPV. Gardasil 9 protects against anal warts. It protects against genital warts, anal cancers, not warts. What do you call? And then the HPV itself. So right now in Ontario, if you are above 9 years old and you're between 9 and 45 years old, you can get Gardasil 9 vaccine for protection against genital warts and anal cancers. Even if you don't have an HPV result that says negative, you can take it for those things. And that's why even men now take Gardasil 9, because of the anal cancers and genital warts protection that it has. So that's the name of the vaccine, and it's 3 times.
Someone is asking, what's of Cervarix? I guess that's another vaccine.
We don't use Cervarix is not like in our formulary in Ontario. I'm not sure where the person is, but
Maybe from Nigeria. I think I've seen it in Nigeria.
yeah, Severix is not in our formulary here. It may be the exact same medication in it. I don't know. I've lost touch with that one, but it may be the exact same, I think. Possibly just a name difference, but what we use here is Gardasil 9.
Okay. Yeah, she said we use it in Nigeria. I think I also took the vaccine, the Severix vaccine, while I was in Nigeria.
And if you completed it, then you don't need a repeat. But if you didn't complete it, you have to restart.
Okay.
Yeah.
Someone is asking, getting circumcised reduces the urge for sex. How can you help get more sexual urge?
Oh, for a female.
Yes.
Okay. So this one, it's it reduces the urge for sure, just because the clitoris is tempered with, but you have to, it gives you extra work to find other pleasure zones in your vulva and vagina. It's not only the clitoris that is a pleasure zone. There are other I don't know if we know, aside the G spot, there's somewhere called the A spot. It's all there. It's all in there, and it's in different locations for different women. So even the G spot, where my G spot is not where someone else's is. So you have to, like, you know, play around with around your vagina, use toys, use whatever it is that you want to use to find where your pleasure zones are. But for sure, it's not finished because you're circumcised. Like, it's not impossible. You may not get the clitoral pleasure, but there are other pleasures that, you know, can be gotten. And again, to raise the hopes of the person who has that question, there is a research article I read that kind of did a study on people who got, women who got circumcised. And it kind of has the conclusion that the clitoris is never, ever, they are never, ever able to cut it off fully. Like, there's always some part of it that is, you know, left there. It's usually very tiny and maybe like a dot and something, but it's there. So if the person plays around that area well enough, it may hit the place that has the small of the nerves left there. So that's another thing. I don't know how true that is, but I for sure read an article about that, but I haven't really looked into it or asked anybody that has this as a case on their own. So, but it's not over. There are other pleasure zones you want to try.
Okay. Thank you so much, Irene. I think that's about it for all the questions in the chat box. Right now, we will just launch a poll. We want you to just take 1 minute to respond to. I have launched the poll. Before we leave, please, we are not done yet. We're almost done, but let's just take a moment to respond to a poll, which I have launched. And yeah.
Just before I go, I just want to thank everybody for coming out. Thank you for sparing an hour, 2 hours of your Sunday to come and listen to this. And if you have other pressing things that maybe you want to hear about and I couldn't really touch, or something that you don't agree with that I said, or, you know, something we can revisit, please just let Ivy know, and maybe we can find another time to just talk. Or Ivy can share my contact, and you can message me, and maybe I can help connect to resources in the community, or provide more clarity, and maybe even show you the article I saw and things like that. So if there's anything you want to follow up on, please just let me know. And anybody that has something to say, you can unmute, because like I said at the beginning, I don't know it all. So maybe from your experience, it's a totally different ball game. You can just unmute and share, and then other people can weigh in as well. So thank you again, and everybody have a great week.
We're not going yet, Irene.
Okay.
She's just turning off her camera. So we're still here. While people thank you for the people who have responded to the polls. We're still waiting for more people to respond to the polls. And then, Irene, we have Ruth saying, thank you so much for the insightful and explicit session. I really appreciate your time. It was really worth it. Glad to know that, Ruth. Omo Bolaji is also saying, thank you so much for the informative session. Abolanle is also saying, thank you so much for this session. So we really got it was informative and enlightening. And I'm sure that, yeah, we took a lot of things out for me today. Ifeoma is also saying, I joined late, but I'm glad I made it very informative. So Irene, we thank you for your time. If we can still take just a minute of our time, we'll soon go, we'll soon finish. But we just want you to please respond to the poll so that we know how best or how better we can serve you. Quick questions, short answers. We just have a few people who have responded. We'd like many more people to respond to it so that, yeah, we'll be done. And I is saying, thank you, Irene, very educative. I appreciate you. Chinaya is also saying, thank you, thank you, thank you. Very informative session. I learned something. I personally learned something today. And I'm glad that, yeah, I was able to be part of this session. And I'm sure many of the ladies here to also share the same feeling. So without, having to keep us here any much longer, I'd like to thank everyone for joining in this evening. Thank you for sparing an hour, 30 minutes of your Sunday evening, to join in for this session. It's our desire at the Health and Wellness with NIROW to make sure that women are empowered, they have enough information that will help them live healthier lives, and increase the quality of lives they live. So that's why we always come up with these programs. And your joining in makes it all the worthwhile when we are sharing information like this, and we know that you are, it's informative, it's enlightening, and it's adding value. We're encouraged to do more. Like I said, please let's keep in mind next week, Saturday, we have the seniors networking session. If your parents are around and they're around Kitchener, Cambridge, or Waterloo, please sign them up for this very, exciting opportunity to bond with other seniors and, to just enjoy and have fun together. Or if you know any other senior, any Nigerian senior living in Kitchener, Cambridge, or Waterloo, kindly ensure that they are, registered for the event. I had initially dropped the link for the registration in the chat box. If you scroll, you'll find it. So we can all be there. And then, like we said, the vaccination awareness. So Irene spoke about the HPV vaccine today. That vaccine awareness event we're going to have will tell you where you can access some of these vaccines. We can even help you with information on where you can get it and, and how you can, request for it and all of that. So you're also coming to Canada, you're new, your kids need to be vaccinated. The school has different vaccines that they give to the children. So you can always, you can access all of that in that event. I'm seeing a question. My question wasn't addressed. I'm so sorry, Esther. Where is it? Esther, please, if you don't mind. I can't see it from my end. So I don't know if you can help me with it. You can unmute yourself and say, if you don't mind, please. Sorry, before we go and before Irene leaves.
Thank you, Irene. Thank you, Ivy.
Sorry, Esther.
Yeah, I actually want to ask, sorry, I've been posting the question, maybe it's an oversight, I understand. I want to know if Irene can, like, little time, perhaps maybe after this section, kind of describe how well or how better we can do Kegel exercises.
Okay, I'm sure, Irene, maybe you can say that.
And
Okay.
another one, where exactly can we get this vaccine for cervical cancer? Can someone take it even if someone is not positively tested?
Okay, thanks for your question, Esther. I'm sorry that we didn't see it. So your first question, Kegels are exercises that, I'm sorry, I just said it as if I expected everybody to know, but so picture yourself trying to pee, and then in the middle of your pee, you hold it, like you pause your pee. So that's basically what Kegel exercises are.
Let me write that out now.
Okay, let me
Uh,
stop share so you can let me. No, it doesn't matter. You don't worry.
Someone is unmuted there, but
Esther, is that you?
okay.
Oh,
So
I wasn't. I'm not.
no, it wasn't her. I think it
Okay,
was someone else.
okay.
So Kegels, when you're peeing and you hold it in the middle of your pee and then release it after, that's just basically what you're simulating when you're doing Kegels. So of course, when you're sitting in your chair, you're not peeing, but pretend or act like you're peeing and then just hold hold it, count 10 seconds, then release it. Then do it again. So that's the one I'm like, try to just get in the habit of doing it. You know, even nobody knows what you're doing, right? You're the only one who knows. Just do it as often as you can and as many times as you can in a day. Contract, hold, 10 seconds, release. Contract, hold, 10 seconds, release. And the more often you do that, the more it contracts your vagina for you. So that's about Kegel. And then for Gardasil 9, I don't know. I mentioned that you can ask your family doctor for a prescription. You can go to a walk-in clinic and tell the doctor to give you a prescription for Gardasil 9, and they would give you. For women, it's always safer for you to have done the HPV test and be negative. The reason is we all know vaccines are non-live versions of the virus, right? So whatever vaccine you're taking, it's a killed version of the sickness. So if you are HPV positive, for instance, and you go take Gardasil 9.
Sorry, Irene, you are being professional and including some terminologies. A Q version, okay, sorry. We'll
Okay,
get more.
sorry,
We'll get to know more of it.
I'm so sorry about that. What I mean is vaccines are not live illnesses. Like they are, so in HPV vaccine, what you have is the human papilloma virus in that vaccine, but it's the killed version
The
of it.
killed,
And
the one that is dead. The
so
dead
it's
version.
dead.
Okay.
It's dead.
Okay.
It's not live. So
Okay,
what
thank
it's
you.
supposed to do is when it goes in your body, it's supposed to make your body feel like you have HPV and create antibodies.
Okay.
The antibodies
Okay, I
are
get
your
it.
fighters. So it will
Okay,
create
thank you.
antibodies because it feels like, okay, now you have HPV. And once you have those antibodies, you've had them for life.
Oh, thank you.
Okay.
Thank you
So
much.
now if you don't test HPV and you go get the vaccine and maybe there is HPV, then you are strengthening the virus by doing that. Okay. So any doctor would want you to go clear first and be sure that, okay, HPV is negative. For anal cancers and genital warts, those ones, they must see symptoms. So they know you don't have it, right? So those ones, they are okay. They can give a man blindly without even telling him to go do any test, because if you had anal warts or anal cancer or genital warts, they will see. They would see the lesions there. So that one they would give, but for a woman, they want you to cross out the virus, the HPV virus first, and be sure it's not there, because that one can be there and there are no symptoms at all. So they want you to clear that one, and then they would give you the prescription for your 3 doses, and you get the 3 in 6 months, and that's it.
Okay. Thank you so much. Thank you.
No
Thank you.
problem.
Okay, so Eno asked for the flyers for the immunization awareness drive. So I brought out this slide so that you can see. The venue for both events will be 675 Queen Street South, Suite 201, Kitchener, Ontario. Just a difference in timing. The seniors networking event would hold from 10 a.m. to 12 p.m. and the immunization drive will hold at the same venue, but from 1 p.m. to 3 p.m. And I have included the registration links for both events in the chat box. So if there are no more questions, we'll call it a day. I'd like to thank you again on behalf of NIROW Health and Wellness for turning out for this event. I'm sure that it was worth your time. We also like to thank, messages, sorry. Okay. We'd also like to thank Irene for, giving us of her time and her knowledge, during this session. Irene, thank you very much. We are all grateful. We enjoyed the session. It was informative and it has helped us. So without much ado, and so that I don't take any more of your time, thank you so much for coming, and enjoy the rest of your evening. Good night, everyone. Thank you. Thank you, Tonya. Thank you, Chineye. Thank you, Chef Mimi. Thank you, Ugofumi. Thank you, Paulsat. Thank you, Madam Anne. Thank you, Oluwatoyin. Thank you, Eno. Good night.